family, hello friends. This is Dr. T and welcome to Clinical Medicine with Dr. T. So today we are starting a new series in cardiology. So we're gonna do an introduction today, introduction to cardiology. So meaning we're gonna be doing cardiac diseases, right? Cardiac diseases. So cardiac diseases can be classified or divided into acquired or congenital. Congenital heart disease, acquired heart disease. Congenital heart disease, as we all know, these kids are born with these heart lesions, and they're divided into acyanotic and cyanotic. Congenital heart disease, as much as the kids are born with these lesions, but because these kids, they grow and become adults, so which means you are still gonna find some of them in internal medicine. So it's important to bear that in mind. And also, sometimes there's a confusion between congenital and inherited. Congenital pathologies are not necessarily inherited. They can present for the very first time in the family. Unlike inherited, usually with inherited, there's usually a mutated gene somewhere that keeps being passed on from one generation to another in the family. That's inherited. Okay, so we have done a tutorial on congenital heart disease. So if you wanna go and watch that, just go to playlist and go to pediatrics. So you go on the channel, go to playlist, and then go to pediatrics. You're gonna find it there, congenital heart disease. So you're gonna talk more about the acquired now. So bring in some color. Okay, so acquired heart disease, the easiest way to think about them, just remember your anatomy. What is around the heart? What we find around the heart is heart vessels, the ones that we call coronary vessels. And there are pathologies that affect mainly those heart vessels, and those conditions are collectively known as ischemic heart disease. Some people call them coronary artery disease. It's one and the same. So ischemic heart disease, you can further divide them into what they call acute coronary syndrome, call it ACS, acute coronary syndrome, under acute coronary syndrome, you've got three conditions there. You have three conditions there. You have myocardial infarction. As we all know that myocardial infarction has got two types, or is classified into two according to the ECG changes, whether the ST in the ECG is elevated or is depressed, or so you can have a STEMI, you can have an NSTEMI and a STEMI. ST elevation myocardial infarction, non-ST elevation myocardial infarction. The other condition that you find under under acute coronary syndrome, you find unstable angina. Unstable angina, right? So that's what you have. Right? And then on the other side, you have stable angina. Stable angina is not part of acute coronary syndrome. When someone says the patient has got acute coronary syndrome, what they mean is that the patient has unstable angina or STEMI or NSTEMI. That's acute coronary syndrome. Right? And then unstable angina is just on the side there. It's just ischemic disease. It's just part of the ischemic disease. It's not part of the acute coronary syndrome. That's what I'm trying to say. And then I'm full of color today. Okay, so I've got, if you go onto the channel, you go to internal medicine, there's a video there that I did, approach to a chest pain. That's where I speak about this. So please go and look at that video. I talk about the history in terms of the chest pain. What are the things that you need to ask the patient in order to determine whether they've got a typical chest pain or an atypical chest pain. A typical chest pain is a cardiac pain, and atypical chest pain is there are things that you look at. There's typical chest pain, there's atypical chest pain, then there's non-cardiac chest pain. There are things that you look at. So I covered that in that video. What are the things that you look at to say the patient has a typical chest pain? So a chest pain, like I'm saying, can be typical, can be atypical, can be non-cardiac. When a patient has got typical chest pain, what are the things that in the criteria the patient must meet in order for you to say it's typical? If you say atypical, what are the things that the patient must meet in order for you to say it's atypical? And then for you to say it's non-cardiac, what are the things that the patient did not meet to say it's non-cardiac? So you move from there and get to the biochemistry, the ECG, all of that. I discussed those in that video. So please look at that. Okay. Now, we said acquired has coronary artery disease, then acquired has pericardial disease, right? But what I'm going to do is I'm going to clear this so that we can continue with pericardial disease, because we don't have space. So keep this in mind for this session, that okay, we have covered this one. Thank you. Okay, so acquired, we looked at ischemic disease, which affect the coronary circulation. Now in this part, we're looking at pericardial disease that affect the pericardium of the heart, which is the outermost layer that wraps the heart. So pericardial disease, look at them as the infectious causes and then the non-infectious causes. Non-infectious. If you look, okay, under infectious, you can think about all your pathogens, your viruses, your bacteria, your fungi, parasites. These are the pathogens that can cause pericarditis. So in terms of the actual pathogens, under viruses, there are so many of them. I'll just mention a few. CMV, cytomegalovirus, Epstein-Barr virus, Coxsackie, there are so many of them. The list is endless. Under bacteria, the most common, Mycobacterium TB, and then you've got your Neisseria species, most common one, Neisseria gonorrhea, the one that causes sexually transmitted infections, and then you've got Neisseria, the one that causes meningitis. Okay, then there are some Chlamydia species that are known to cause, and then there is also some Haemophilus species, and there's some staph, there's some strep. The list is endless. Now when you come to fungi, you've got things like Candida, Aspergillus, parasites, most common, Echinococcus. Echinococcus, remember, it also causes, this parasite also causes a hydatid cyst, right? Hydatid cyst. More on this. So these are our infective causes of pericardial disease or pericarditis: viruses, bacteria, fungi, and parasites. Now let's move on to non-infectious causes. The non-infectious causes. We're going to look at autoimmune disease, things like SLE, rheumatoid arthritis, scleroderma, what else? Okay, and then you can also look at things like malignancy, most of the time metastasis, from lungs, from the bone, from the breast, from the prostate. So it's metastasis most of the times. And then we can also have things like so we've got autoimmune, we've got malignancy, we've got there are some people that mention trauma here, both traumatic and non-traumatic, which is like blunt. So guys, this is just an introduction. We are going to talk about these conditions more and more as we go forward, but for now it's sufficient to keep these. So the next thing that we're going to be talking about now is your myocardium. What are the conditions that affects the myocardium?